I welcome the opportunity to speak today about the Women's Health Action Plan, which was published a few weeks ago. But before looking at the details of the plan itself, I just want to reiterate a point I made earlier in the week when I had the opportunity to speak about waiting lists. It's very important that we get the basics right. We can have all the fancy plans in the world, but if we have waiting lists getting longer and longer, then the plans won't meet their targets and people won't receive the help and support that they need. Both women and men's health outcomes will be improved with the reduction of waiting times for important consultations and treatments. What worries me when reading down through this plan is that many of the welcome initiatives will go the way of everything else in the HSE: waiting lists, lack of staff, lack of capacity, etc., etc. This is my major fear, because I sincerely hope that the aims and objectives in this plan will be successful and a lot better than what we had for our MESH survivors, who had to primarily go abroad in most cases for treatment. I would like to focus first on the section of the plan entitled "What will change in 2022?" because that's what's most important. What is the plan actually going to achieve? I see an aim to have 9 specialist eating disorder teams operating nationally. I hope they will be properly staffed, because the long-time absence of a dietitian in CAMHS in Wexford shows the difficulty in staffing in related areas. I also welcome the provision of an improvement in maternity bereavement services. It is a devastating time for parents when a child is lost, either through a miscarriage or premature death. The availability of support services should be widespread to help people cope with such a loss. The plan in general focuses on the headings listen, invest and deliver. In fairness to those involved in healthcare provision and at government level, I think that listening and investment are usually done pretty well. We have more than adequate funding of our health service. The Department of Health budget has increased from 13.6 billion in 2016 to just under 22 billion in 2021. No one could say we aren't investing. However, it's the return on that investment that continues to be a question. Which is the delivery part within the HSE? In the delivery section of the report, many phrases are used, such as "we will improve," "we will develop," "we will support." But the action plan is very bereft of specific targets. Maybe they would be published later, Minister, but without specific targets, there is no means to judge whether or not this action plan is working. Using phrases such as "we will improve" and "we will support" are vague, non-specific phrases. We need a different approach in health, because the current approach of accountability in achieving outcomes is just not working, as the length of our waiting lists demonstrate all too clearly. We need specific targets, specific budgets to achieve those targets, and specific people responsible for ensuring that those targets are met. We can then easily compare the plan with the actual results to measure its success and hold people to account for any shortcomings. I've spoke previously about menstrual health. 12 months ago on International Women's Day's debate, I said that we need to ensure that no woman in this country is unable to access menstrual products due to poverty or is reluctant to ask for provisions due to embarrassment. I am pleased to see this referenced in the action plan alongside gynecological and pelvic health. The plan mentions 2 specialist endometriosis services for complex care. The Minister will be aware that March is Endometriosis Month, and what has been called for is fertility clinics for women in late stages of endometriosis, free contraceptive for women with endometriosis and polycystic ovarian syndrome. And there needs to be more awareness of both, as they are severe illnesses. The Minister, in closing this debate, you might inform the House that you are aware of the serious shortage of the non-availability in HRT patches and gels, and this is what many women would say are life-changing medications and life-saving medications. Also, Minister, the ICA, the Irish Country Women's Association, have written to all Oireachtas members to hold in regard what the National Women's Council of Ireland say, a dedicated Minister of Women and Equality or a Minister for Domestic Sexual Gender-Based Violence. Violence against women must end and action must be taken with that in mind. I want to acknowledge, Count Corla, the initiative of Colour Her Way taken by two Wexford ladies, Christine Doyle of Christine Doyle Wellbeing and Amy Murray of Deluge Cafe, who are providing purple gilets with personal alarms built in for women and girls who wish to walk or run so that they can feel safer and more confident. Thank you.